This is PUB858, Case Study 2, response of the WHO Director General to COVID-19. Greetings to the viewers and listeners around the globe. As many of you know, we are currently in the midst of a global health crisis. The crisis is due to the pandemic caused by the COVID-19 virus. In December 2019, cases of respiratory illness began appearing in Wuhan, China. In January 2020, Chinese authorities confirmed that these cases were linked to a virus, the novel coronavirus, or as also referred to, the COVID-19 virus. Today, a mere 7 months later, the COVID-19 virus has spread across 210 countries, infected more than 6.7 million people, and resulted in the death of 393,000 people. And these numbers continue to rise. For this reason, I think it is important to discuss the capabilities of the virus. The coronavirus, or the COVID-19 virus, is an infectious respiratory disease. It is caused by the SARS-CoV-2 virus. The virus is transmitted via air that is contaminated by droplets or small airborne particles. An individual that is infected can, by way of air, transmit these particles or droplets into the air and then can be breathed in by another person, resulting in a potential infection. Most individuals who become infected have a mild or moderate illness. And this illness is characterized by the common symptoms of either fever, cough, tiredness, loss of taste or smell. However, some individuals have a more serious disease progression. These are the people that we refer to as having a more serious or severe illness. And some people are at an increased risk of having this happen. These people include older individuals, people with health problems such as diabetes, heart disease, previous lung disease, or even things like cancer. However, the WHO is currently working towards managing this pandemic, to control it, and ultimately to prevent it from continuing and recurring in the future. The WHO's mission and vision is to create a world where people can attain the highest possible level of health, to promote health and to keep the world safe, and to advocate for those who are most vulnerable. As the Director General, it is my duty to uphold these values. And together with the WHO and its connected institutions like the United Nations, we together can do the following. Generally do the following. During times of crisis, such as the COVID-19 pandemic, we do this. We uphold our values by communicating with the public, with the communities, with the governments. We communicate the truth of our global situation, the truth of our numeric situation with the virus, how many people are dying, how many people are getting infected, how many people are becoming ill. And we also transparently discuss what we're doing to get ahead of it. We also help spread vital information during times of crisis. This involves providing reliable and up-to-date information. And this also involves combating misinformation where it rises up. We strategize and we create action plans on how to respond to the pandemic. We do this by collecting data. We do this by creating preparedness plans and response plans that we can use now and in the future. We support nations, authorities, and communities, and we work together with the private sector, with donors, and with partners, as well as the scientific community. We collaborate with them to create the best viable information and how to curb the spread of the virus. Together with the WHO, I'm also related to I also oversee the WHO as it relates to international health work, facilitating international cooperation. And this is done by cooperating with heads of state and those appointed as envoys. In this current climate, this role has become increasingly important. And for this reason, I want to discuss some of the responses that I and the WHO have devised. Firstly, the appointment of envoys is very important. The function of these envoys is to help spread information that the WHO has proposed to increase awareness of COVID-19 response and preparation, to create strategies for preparation and for response, the how of the matter, how this can prevent COVID-19 outbreaks from continuing. We work together with countries, governments, political bodies on an international level to create policies and regulation that will mitigate the spread of COVID-19. This involves things like hygiene protocols, mask usage, treatment protocols, intra and international travel. And these envoys that will help do this, they're appointed on a multinational and often multicultural level to increase the reach of the WHO and to expertly account for cultural differences and sensitivities. However, as the world continues in this crisis, we must also consider the economic and social implications. And it is the role as well of the WHO to balance the economic and the social with the epidemiological so that we can have a balanced and efficient prevention of COVID-19. The world's other crises do not halt because of COVID-19. Many displaced individuals, such as refugees from war, must be given special consideration as these individuals often live in situations that are favorable for the spread of the virus. Conditions in refugee camps for this reason must be maintained in a manner that ameliorates this risk. We are currently also expanding efforts to provide hygiene materials such as masks, sanitizers, running water, shelter, and medicine to those who do not have. We aim to extend the same effort to under-resourced hospitals to give healthcare workers and their patients the necessary resources to combat the virus. We will continue to work with the scientific community, with private sectors, and the public sectors, and the health institutions that they're associated with to develop a possible vaccine down the line that will ultimately curb the spread of this virus. And now I want to speak to the public for a moment. During trying times such as these, it is important to be vigilant and to do our part in curbing this virus, because every individual's participation has an effect. For this reason, following national and regional updates and guidelines is very important because it allows us to stay up to date and it allows us to think critically when confronted with potentially misleading information. Similarly, following hygiene protocols, hand washing, sanitizer use, proper coughing and sneezing techniques are all things that you can do as an individual that prevents the spread of COVID-19. Getting tested for COVID-19 if you have symptoms of infection or if you've been exposed to someone who has symptoms of infection. Isolating from others and social distancing. Wearing personal protective equipment, PPEs, such as gloves, goggles, or masks, if you're in an area where you think you might be exposed. These are all things that we can do as the public to do our part in preventing the spread. Thank you.